Hi guys, and welcome back to my YouTube channel. It's 247 Online Nurse, and let's get to know what January has for us in store. And it being cervical cancer awareness month, the videos which I'm going to put or upload in January, they are going to be geared towards cervical cancer. We need to know more about this monster called cervical cancer that usually robs our sisters, our mothers, our cousins, and our relatives in general. We need to know what we need to do different this year and the years to come so that cervical cancer cases goes down. So guys, let's get into the video. Let's get to know what causes cervical cancer and what are the signs and symptoms and what we need to do different so that the cases goes down. So guys, welcome. So cervical cancer is very rare in high income countries as compared to low income countries and moderate income countries. So you'll find that 90% of the cases diagnosed of cervical cancer and also 90% of the deaths related to cervical cancer, most of them, they usually come from low income and middle income countries. And in 2020 alone, there were around 600,000 cases that were diagnosed with cervical cancer worldwide. And so sad that more than half of the cases that were diagnosed with cervical cancer, most of the patients, more than half of them, they succumbed from cervical cancer related complications. So guys, it's very sad. That's why we need to learn more about cervical cancer. So cervical cancer usually starts from the cells of the cervix. And what we know about the cervix? Cervix is the lower part of the uterus that connects the vagina. So that's where the cervical cancer starts from. And what causes this cancer? Cervical cancer. Cervical cancer, around 99% of cervical cancer is caused by human papilloma virus. So this is the monster, the human papilloma virus. Guys, we need to know more about this human papilloma virus. So human papilloma virus can be transmitted from one person to another. And especially if you are sexually active, we are at more risk of getting human papilloma virus because it can be transmitted through direct sexual contact, be it anal, be it vaginal, be it oral sex. You can get human papilloma virus. So even through skin to skin contact, you can also get the human papilloma virus. So guys, around 9 to 10 cases of human papilloma virus infection, they usually clears or goes away within 2 years. That means the body has natural mechanisms of doing away or clearing the human papilloma virus from someone's body within 2 years without any health complications. However, you'll find that some people usually have recurrent human papilloma virus infection, and this is dangerous because it can cause the recurrent human papilloma virus infection. It can cause genital warts, or at some point it can cause cancer. So guys, human papilloma virus is the one that causes cervical cancer and other types of cancer. In other types of cancer, we can talk of vulval cancer, we can talk of vaginal cancer, we can talk of penile cancer, we can talk of throat cancer and also anal cancer. Those are some of the cancers that can be caused by this human papilloma virus. So guys, we have learned so much about this human papilloma virus, how it is transmitted, and now let's get to know the types of human papilloma virus that causes cancer. There are two notorious types of human papilloma virus that causes cervical cancer. And one of them is human papilloma virus 16, that is HPV 16. Then the second one is HPV 18. And then there's an additional one, HPV 45, which is at some point is silent. We only know of two major ones, the 16 and 18, and still there's still the 45 one. Then there are other types of human papilloma virus that causes cancer, but those ones, they are not as dangerous as 16, HPV 16 and 18. So guys, when somebody has cervical cancer, how do they present? How will you know that a mother, your sister, your cousin is having cervical cancer? These patients may present differently, but there are some things that you can pick from what they are telling you. For example, if somebody has a vaginal bleeding between her periods, or after having sexual contact with somebody, or when somebody is, as in, after the menopause, you're still bleeding, it just brings some question mark that this person could be having cervical cancer. Then another signs that can lead you to knowing that somebody has cervical cancer is they usually have pelvic pain and also pain during the sexual intercourse. Some people will present with lower limb pain and they can also swell. Some women will present with vaginal discharge, which can be very thick and at some point bloody and also full smelling. And then some patients can present with a lack of appetite. Some patient can be very fatigued, and at some point a patient can present with unexplained weight loss. That means each time these patients come to the clinic, the weight is just going down, down, down. Start having question mark about this patient could be having probably cervical cancer. So guys, what is our take-home message about cervical cancer in this video? We need to know three things. We need to get informed. That is one. After getting informed, we need to get screened. After getting screened, we need to be vaccinated. So those are the three things that we need to take home. One, let's get informed. Let's get to know what is this cervical cancer we are talking about, what causes it, and what are the signs, and how can we prevent ourselves from getting cervical cancer. And let's get to share this information with women, with our friends, with our relatives, so that they can go and get screened. They can know the signs that somebody has when they have cervical cancer. Very important information. Let's get informed. That's number one. Number two, let's get screened. Let's get screened regularly for cervical cancer. I know at this juncture, so many patients, so many women find it difficult to go just pop into a clinic or maybe schedule for a cervical cancer. I can tell you, it's not easy. It's not easy. And women usually give like so many reasons that I'm not ready, I'm not psychologically ready today, I've not taken a shower, I'm on my periods, simply because they don't want to get screened for cervical cancer. We need to get screened regularly so that we can know whether we have this monster called cervical cancer, or we are having the human papilloma virus that causes it. Very important. Let's get screened. We need to preach this gospel of let's get screened for cervical cancer. Then the third thing that we need to do is to get vaccinated with human papilloma virus vaccine. So we need to take our girls between the age of 9 years and 14 years. They need to get vaccinated. Yes, and this vaccine is very safe and it can prevent us from getting cervical cancer. So three things: get informed, get screened, and then let's take our girls for vaccination. So guys, that's all for today. I'll be informing more this month about cervical cancer. So guys, just be checking on my YouTube channel this January. Let's get to know about cervical cancer because it's a cervical cancer awareness month. So guys, bye bye now. Bye bye for now. If you find this video interesting, share it with your sisters, with your cousins, with your mothers, with your relatives, and let them get informed, let them get screened, and then let's vaccinate our girls to save the generation. Bye bye now for the next video. Bye bye.